So we're still in the same section. Okay. We're still in the same section, but we want to talk about treatment planning, and actually, in a way, this is what Miss Clayton was talking about. She's talking about, like, how do we approach certain things, and what do we do, and all that kind of stuff. The number one thing I want to say about treatment planning is really, in many ways, the client should set this up. And I don't mean that they should decide everything you're going to do, but the question is, what are the client's goals? You might think they have a tight back. You might think that's what should be addressed. But they might be telling you, like, I'm coming to you for rest and relaxation. I don't want you to fix my problems. I don't like deep work. I don't care what Tapscott says. I want light work, and I come here just for an emotional break. So their treatment planning would be based around that input, if that makes sense. Hopefully it does. And some of the other things to kind of take into account is you're also going to make sure their treatment plan has things that are within your abilities and within your scope of practice. So if somebody comes in and you think their back is horribly out of whack, you might be referring them as part of their treatment plan to see a chiropractor, right? Doesn't mean you can't massage them, but the point is some of your treatment plan might be out of your grasp. And so it's completely okay to tell people, like, that's beyond my expertise, and it's really best if you go see a doctor about that, or a chiropractor, or whatever. Ms. Hendrickson, please.
Would you, like, have a specific person that you're referring to them to, or, like, this chiropractor, or would you just be, like, any, like, or would that be, like, normal to, like, have, like, a list of people, like, here's a sports medicine person, or here's a chiropractor, or something like that?
Both are normal. Both are normal. I've done both. I have given people general referrals like, hey, I think you should get this looked at, and it's way beyond anything I am capable of dealing with. And if I have somebody that I really like, I might tell them somebody, but you don't have to. Either way, it's completely appropriate to do either way. You can refer them to a specific person, but you don't have to. Usually this comes up with stuff like, this is a silly but very common thing that comes up. You find a bump on somebody and they always go, what is it? And I go, I don't know what it is. And I go, you should have a doctor look at this. That's just a blanket referral, right? I'm not telling them a specific doctor or anything, but I'm like, you really might want to see a doctor about this because I can't diagnose that. And as much as you want me to, they're like, well, you see a lot of this stuff, so did you have a good guess? I don't even go down that route on those ones. I always reassure them, I go, it's probably okay, but I have had clients, and this is the truth, I've had clients come back to me and thank me because they found out it was some precancerous thing, and they caught it early. And so I said, don't panic, but go get it checked out. I'm always telling them, don't panic, go get it checked out. And I've had that happen, and I've had other massage therapists have that happen, where people have come back and said, oh my gosh, this person probably saved my life in the long run because they caught this thing and they found out it was early stages of skin cancer and they caught it, that kind of thing. So, but also could be other funky stuff with, like, I don't know, joints or things like that where you're like, this really seems really crunchy and weird in here. You might want to get this checked out. You know, that kind of thing. Yeah. Miss Rader.
I was just going to add that I would just be careful about referring people to specific providers, and make sure if you are doing that it's somebody that you really know and know what kind of results they have and what kind of a doctor they are, because it's going to reflect back on you if you send them just to somebody because they're close to your massage studio and they end up getting bad advice or bad treatment, then they might look on you a certain way.
Thank you for adding that. You're absolutely right. I was making that assumption, and you were 100% right. Refer to people that you believe in if that's what you're doing. Otherwise, just give a blank referral kind of thing. Ms. Abelos.
Yeah. Like working with clients and patients and stuff, I think it's so important to scan the body, because how often does someone look at your back or the posterior side of your body, and you can find things that they aren't even aware of. And legitimately it can save their lives. So,
Oh yeah.
you know, I wouldn't pinpoint someone like, you know, go to this doctor. I would definitely say, hey, this spot looks funny. Whether you know if it's cancer or not, and send them to a dermatologist or their primary care. But I definitely would say something, and I would tell them to definitely get it looked at. Because I've had it done for me before,
Oh yeah.
you know,
No.
and it's very appreciative.
Oh yeah. I 100% agree. We look at people's bodies closer than their own spouse will, right? And I'm not trying to be weird, but their spouse might be intimate with them, but their spouse isn't looking at the backside of their body and rubbing every section of it. Like we would probably inspect them, not even probably, I almost 100% guarantee you will inspect their body more than any doctor has, any person has in their life. And you would feel terrible if you didn't refer that stuff out. I always mention stuff on the backside of the body. Sometimes in the front I won't if it's like, they got a lump on their chest, they know they have a lump on their chest. But anything that I think there's any possibility they don't know about, and even if I'm like, this just feels like a lymphoma, which is like a little fatty cyst, I still tell them about it. Always, because people have written back, told me, told other therapists, yes, exactly what Ms. Abloh said, that they probably had their life saved. Ms. Carrillo.
Referring back to clients' treatment goals and treatment preferences, I remember watching some, therapist videos before, and this therapist mentioned that, example, if a client had like something tight in the, let's just say like something tight in the arm, and he said that he would definitely work the arm, but because his expertise would tell him it's got to be through the neck, the shoulder, the client would be like, why are you working that? And he used to lose clients, or he stole clients. He would make sure to work the arm, but he would also be like, hey, maybe next time come in and I'll work here. I'm trying to like put it into words, but it's like where we kind of need to step back just a little bit and do what they want. So I'm basically agreeing, like type back that they want therapeutic. You do the therapeutic, but probably inform them of the type back.
Yeah.
I'm so sorry. I'm trying to get my thoughts together.
No, Ms. Creel, maybe I can help, and you let me know.
Yeah.
I feel like there's this important balancing act that I do. If somebody comes in and says, my neck hurts, but I think it's because of their back. Let's just use that simple example. I, of course, am going to work their neck. I have to address the thing they came in for, right? But then I'm going to say, hey, I think this might be coming from your back. Can we spend some time on your back, right? I'm always trying to sneak in myself because I know they're going to go away even more satisfied if I really fix the problem. And if they refuse, if they're like, nope, nobody touches my back, nobody ever touches, then okay. But you're right. So we're always kind of trying to like make them happy, give them the thing they asked for, and then get them to try more. Right? And I have that happen with people that have herniated discs. They're like, don't touch that area. I'm like, okay, but can we work around these areas? Oh yeah, that feels really good. Now do you think we can go in there a little bit? Well, yeah, maybe. I gently push them towards stuff that I think will be good for their therapy. So I'm definitely trying to input my opinion and my experience, but they do get to set that boundary. And you're absolutely right. And you've got to first off just address what they came in with. Because everybody comes in, they're like, this is killing me. You got to address that. Is that kind of what you're saying, I think? Yeah. You're right. It's
I just thought like maybe it would help for everyone to know that too, that even though we have that knowledge, if the client doesn't get treated where they know where they're having the issue, then they probably won't come back.
Yeah, exactly. Yeah, and then by the way, they're paying $100 an hour essentially. No matter where they go, essentially they're paying that. And for $100 an hour, they expect individualized treatment. I do. And I always say if somebody came in and said, rub my big toe for an hour, I would do it. I would say, now, it might help if we rub the rest of the foot too. Would you be open to that? I would try. But if you're like, nope, big toe, I would become the best big toe rubber ever. I'd be like, can we do both of them at least? Like, I really would. I would get in there and figure it out, all the joints and play with. That's what I meant about thinking on the fly. And I have had those type of strange requests, not the big toe one. But I do remember a guitar player asking me just to work his forearm on just one arm for like an hour. And surprisingly, by the way, you can do that. There's loads of stuff to do in there. But anyway. All right. Good times. Where were we? Okay. So in your treatment plans or in your treatment planning, this doesn't even have to be something you write down. This is in your head. Like, what are you going to do with this person? It is really nice to also find out not just things you're going to work, but things you're going to avoid. So regular clients, all clients, have things they like and dislike. And I like kind of starting to figure out what to avoid too with them too. What can we not work on when trying to do this? What are their goals? All that kind of stuff. And people have different aggressive levels. Like some people aggressively want you to attack their problems. Other people really just want to kind of get a massage because it makes it feel a little bit better and they don't actually want that. You have to kind of figure all that out. Remember when I said there's all these different names for soap notes? And I said Pico is one of them. Pico is still this kind of concept of you know, what's the patient and the problem? What are you going to do to them? What are we using to compare that to, and what kind of outcome do we get? It's really another way of figuring out is the massage working? And so there's just all these different approaches, but they're all essentially soap notes. What am I seeing out here? What are we doing? Is it working? Is it working? There's lots of different ways to figure that out. Massage therapy and injury, you guys already know this from contraindications that you have done. Essentially, we can work on a whole lot of stuff, but essentially we don't work on people when there is a systematic problem. So if I'm running a high fever, that is not just a high fever in my head, right? It is a high fever in my body. My entire body is fighting off an infection, and the general rule of thumb with a high fever is you do not work that person at all. Does that mean I think they'll die if you just rub their feet? Probably not. So, have I ever done that before? Have I ever bent that rule and done exactly that thing? Yes, I have actually. If I have somebody come to me and they're like, I'm running a little bit of a fever, and they look fine to me, and I'm like, we really shouldn't massage you today, and they're like, oh, I just really want to relax. Well, how about we do reflexology? It's not going to go kind of crazy. I don't want to turn them away. I think they're healthy. I'm taking a risk, by the way, but I feel okay with it. But I just want to let you know the textbook answer is systematic problems, absolute or general contraindication. We don't mess with them. All the other problems we've talked about tend to be local contraindications, right? And the general rule of thumb there is if it's swollen, that's when it's in its inflamed state, leave it alone. When that swelling starts to come down, it looks better, you can start to meander your way in there and see how they do with it. Don't spend 2 hours on their elbow that was swollen, you know, a week ago, but you can start to do a little bit of work in that area and see if it gets better. You talk to them the next time and see if it gets better. So that's just general rule of thumb. If it's a system-wide problem, then you don't work the system at all. If it's a local problem, you don't work that local area while it's inflamed and swollen. After that goes down, you can usually work most problems. By the way, assuming there's not a break in the skin and all that kind of stuff. They're just defining major and minor surgery. Major surgery usually gets into your organs and such, gets inside your body. We've already talked about referring. That's just the act of you referring out. That does not mean you have to stop massaging them usually. I often refer people to see a doctor and keep massaging them. Let's see. Okay. Informed consent. This is really, really important actually. This means that a client gets to make the decisions about their treatment once they have been informed on what that treatment is and what it means. If I say, hey, I've got this treatment plan, I'm going to work on your glutes, and they don't know what the glutes are, they can't give informed consent. If they say, yeah, that's fine, but they don't know what the glutes are, that's not informed consent. They're not informed. I told them stuff, you know, but it's just like when you talk to a little kid sometimes, you're like, hey, let's do this thing, and they don't know what you're talking about. They don't know what they're saying yes to sometimes. You want your client to know what they're saying yes to. I use this all the time for pressure stuff. I mentioned this yesterday, but just really quickly. Like when I'm going deep and somebody's like, hey, you could go deeper there. And I'm like, okay, I'm actually okay with that. Your tissue will handle it. But I think you could be really sore. Are you okay with that? And then they say whatever. But the fact is they're informed of what they're not just asking me to go deeper. They're informed about the consequences of going deeper. They're not just telling me it's okay to work on their glutes. They know their glutes are their bottom or their hips. They know what they're saying yes to. That's informed consent. And so, by the way, I find it's classier and more personable to talk to your clients in regular language. So I don't call the glutes, I call them their hips. I talk to them in ways that they would understand, and not like I'm talking down to them, but I'm not going to talk to them about the supraspinatus if they don't know what the supraspinatus is. I'm going to be like, oh, you got these muscles called your rotator cuff muscles that help provide stability to your shoulder, and I'm working on one of them. If they ask for more, I show them I do know my stuff, and I go really into detail. But the point is, you actually look like you know more if you don't try to throw out $10 words. You really do. But you've got the $10 words ready if they need them. Mr. Mitra, please.
If this is like all verbal, so on the informed consent, is there something they're supposed to sign? Or if you are in the middle of a massage and they agree to it, then do you just go back and write it in your soap notes? Or how do you keep track of this so if something happens, you're covered?
Yeah. So, Mr. Mitra, you're absolutely right. You would go and put them in your soap notes afterwards. You're probably not going to have to sign off on something. If it's so risky that you think you need them to sign off on it, you probably shouldn't be doing it. Does that make sense? And by the way, Tapscott doesn't even put it in my soap notes. I'm just kind of covering my butt, making sure they really understand what asking me to go deeper is, or what doing this thing is, or whatever. Because usually then they remember that the next day, and I've never had a problem with that. But you're absolutely right. If you want to do technically what you should always notate what you asked the client and what they told you, and you need to do it every time. Because I have been involved with court cases that involve notes, and they pretty much boil down to how thorough your notes are on all your clients. And when they see, I didn't actually have it with clients, it was a different thing, it was with employees, but when they see that you keep really detailed files on a whole bunch of people, they assume the detailed files on this one person are correct. And so if you are, it sounds like you are thorough like that, and I commend you for that. So make sure, anytime you do it, there's a note in the file really quick, told client that blah, 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 they said yes. And I think you'll be fine with that. If you guys need more consent than that, that's usually when we want a doctor to sign off on something. So you have somebody who's like going through chemo, they don't look good systematically, and I'm like, I don't think I should work on you, and they're like, no, it's fine. I really want your doctor's approval for that. And that's when they bring back in something that's signed by the doctor that says, go for it. You know, that kind of thing. And by the way, I've had that happen. They come back in, and sometimes it's a little bit overwhelming. The doctor sends them back in with something and says, go for it because we think they're terminal either way, and you're really there to provide palliative care. But they signed off on it, and then at that point I kind of do judiciously whatever the client wants. Yeah. So if you really need signed paperwork, then it's serious and get signed paperwork, but probably from a doctor at that point. We don't have to go through any of that stuff, thank goodness. Sorry, guys. Are these potential? Okay. Let's talk about some of the benefits of massage therapy. I want you to realize that there are lots of documented benefits to massage therapy because you guys will run into a challenge You guys will run into a challenge. Hold on, I'm just going to mute somebody here. There we go. You guys will run into a challenge when you're doing out calls, when you have personal clients, and you tell them, I charge $100 an hour for a massage. Now, I think that's very reasonable to go to somebody's house and charge them, but they're going to want to know what they're getting for that. Why would I pay you, or anybody, not just you, anybody, $100 an hour for their time? And that's when you want to have benefits, and you want to have a whole list of benefits in your head, because different benefits apply to different people. So if it was Mr. Jones, I would talk to him about the fact that massage helps you repair quicker from your workouts by increasing blood flow, and therefore you can grow muscle faster because you're actually repairing quicker in your downtime, and therefore you're going to get more muscle growth during your downtime. I would also I would also tell him, by the way, massage does this really cool thing where it makes your ligaments and tendons and fascia more elastic, and therefore it's less likely to tear and you're less likely to get injuries. And I will say, Mr. Jones, you know as an athlete that actually the biggest thing that holds athletes back are injuries. Their workouts are usually going pretty good and then they get injured. That sets them back 3 months. So massage helps you. It's horrible. Massage helps you avoid injuries. In fact, many athletes say the key to success, being a high-level athlete, is just avoiding injuries. It's not even the training. It's, can I avoid injuries enough?
Actually, that's the most important part, for sure.
Yes. So Mr. Jones is buying this thing. It's the truth. But he's buying this thing, right? It feeds right into what he cares about. It helps reduce injuries, and it helps him repair quicker. That's one of the things that I would say to him, right? We all know it reduces stress, correct? But people also need to know what happens when you reduce stress. And I always tell people this too. I go, I'm not just saying it reduces stress. We now know that stress is a contributor to illness, a major contributor to illness. We know that for a fact. By the way, I think it pretty much is illness. That's just me. But we definitely know it's a contributor to illness. It's a contributor to your immune system and everything. It is a killer. Stress kills. That's not just something we put on a poster anymore. That is a fact. Stress kills and massage reduces stress. Yes, we know that. We know that massage helps reduce anxiety and depression. And most people can relate to that because most of us deal with some sorts of downs in our life, right? You're human. Absolutely. So anxiety and depression. We know that massage can actually give a client instant increased athletic performance. So let me give an example here. If I'm a runner, and by the way, I can make this argument for any athlete, but if I'm a runner and my hamstrings are tight, I can't get my leg fully forward to get the stride I need. And my quads actually have to fight against my hamstrings. And this could go vice versa too. It doesn't just have to be hamstrings, it doesn't just have to be quads, it could be anything. But if the opposite muscle is fighting my power muscle, it's as though my power muscle has to overcome the tight muscle and still move my body forward. So you guys have seen my little gray Honda Fit outside. It's as though I have a trailer on my Honda Fit. Massage can remove the trailer. Now my Honda Fit actually didn't get more powerful, but is it going to drive like it got more powerful? Yes. Athletes get immediate increased performance if we can get the antagonist muscles to quit antagonizing them. That's immediate. So I go to an athlete and say, you will run faster, you will run farther, you will jump higher. You can actually make people jump higher. Truly. So they play volleyball or something like that. And actually, little trick there. One of the things that allows you to jump higher is your ability to fully open up when you jump. Right? All of us can bend down, but can I fully open up when I jump? And one of the things that limits me from that is a muscle called my iliopsoas, two muscles. And so if we loosen up their iliopsoas, they can usually jump higher because they're not kind of just opening up part way. They open up all the way, and they can jump higher. Instant. Takes 15 minutes. Open up an iliopsoas. Obviously, massage removes aches and pains. Obviously, people sleep better when they get massage. And sleep is very closely related to people's health. So it helps with that. It helps reduce tension headaches. It helps reduce the severity and how often migraines occur, right? Or any type of headache, right? Oh. Sorry, I thought there was more on that list. Any other benefits that you guys can think of? I'm not expecting some particular thing. I just think there are more, though. Miss Clayton, please.
More energy. Sorry, more energy.
That's an excellent one. Thank you, Miss Clayton. I completely forgot about that. More energy. And so if you have a type A person, tell them, hey, it's going to give you more energy so you can take on the world. Yeah. And if you don't have a type A person, it's going to give you more energy so you can kind of get through your day. Miss Hendrickson.
I'm not sure if you mentioned the lymphatic.
I did not.
I guess function, and then also just your overall mood.
Yeah. So lymphatic flow tends to increase with massage, which means you're getting more debris out of your body quicker. That's fantastic. And you said general mood. Yeah. It is a mood elevator. It actually releases oxytocin and serotonin, which are mood enhancers. And it does it in a really healthy manner. Yeah. It's very, very, very good for your mood, and all of us could use improved moods. Yeah. Mr. Singletary.
Social anxiety.
Oh, yeah. It can help with social anxiety. Thank you. You're right. Well said, sir. Miss Carrillo.
It could help with blood circulation. So if blood is just sitting there a lot, you can use the strokes, even with effleurage, just to start getting the blood warmed up and moving throughout.
Yeah. You hit a really big one there, right? Because that's a lot of massage right there. And it's amazing what happens when you just get circulation going. Yeah, it's amazing. Yep. Anything else? Anybody? Oh, Miss Everson, please.
Body image issues. We can help with body image issues.
Oh, Miss Everson, thank you. I've forgotten all about that. But you guys have probably already experienced that. Do some of you feel better or more comfortable about your body now than when you started class? Right? That's one of the things I love about massage. And you can help a client so much by being like, no, that's a normal whatever. I see them all the time. They're so relieved. They haven't seen that many feet. They haven't seen that many bellies. They haven't seen that many. They've seen airbrush stuff on some screen somewhere, but they haven't seen real bodies. People don't even know what a real body looks like anymore. Thank you. Yes. Body image stuff. Oh my gosh, if we could heal the world of body image stuff. Sure. Mr. Richards.
More mobility and range of motion, sorry.
Yes, thank you. So, more mobility, range of motion, easier motion. Just the ability to move easier. I love that. Miss Carrillo.
From my personal experience, I just remembered this. It could even potentially help you breathe better. Because I remember I got massage for one thing, and I also did self-massage around my rib cage, and I guess I hit the serratus anterior and around my back, basically around the thorax, and I was able to breathe better.
Yeah.
And take in more air than before.
Yeah. That's not in her imagination, by the way. That's something we do for athletes especially. But yes, you can make the rib cage expand easier, and that makes breathing easier, and that's the carburetor on your engine, everybody. Just like your car has to take in air, you basically take in air basically for the same reason your car does, so you can burn energy. And if your carburetor gets put on, that's why they have those big blowers and turbochargers on cars, get more air in them. When you do that for somebody's rib cage, they function better. They're getting more oxygen in, they're getting it in easier and faster. Yeah. Anything else? These are really good and really true. Not even a stretch. Miss Carrillo, please.
They could release nerves that could potentially be pinched
Sure.
so it's like blood circulation as well, but it could be a first result instead of just jumping to surgery.
Yeah.
They could potentially just have tight muscles around that area, and so decreased numbness.
Thank you for what you said about surgery, by the way, because I have lots of people that are like, oh, they say I'm going to get surgery for my carpal tunnel. And I'm like, you may. I'm not a doctor, right? But why not try a couple of massages first? What's a couple $100 before you have somebody saw into your wrist, right? Always a good idea. Might just be some pinched nerves that you can easily solve. You never know. Miss Abelos.
Hi. I think it's really important for like emotional release. Like we're storing all of these repressed emotions and traumas inside of our body, whether we know it or not. It's just a way we function. It's cellular memory, muscle memory, and it just stays in there. So when you work that out, there's not just a release of toxins, but it's literally a different type of toxin that can kill you that's in there. So I think that's a wonderful benefit to massage for sure.
Miss Abelos, you are preaching to the choir. I don't tell everybody that because some people don't want to hear that, but I think that stuff is, those are the toxins. You're right. It's the emotions. Yeah. Miss Hendrickson.
Yeah, I love what she said, and also I would add that your brain and body is so connected. So like when you have, like for example, like your stress, and then your posture is going to suffer from that, and then like it adds to your stress, and then that adds to your bad posture. So like it's all connected, and like when you like feel better emotionally, then you can like stand up straighter and like breathe better and all of that. It's all
I agree.
all in the
It's
same
all
system.
connected.
Your body doesn't. I mean, your brain doesn't know the difference between like emotional pain and physical pain. You still feel it, you know, as pain.
Yeah.
Right.
No, you're right. You're right. They're intimately linked. In a way, they're almost the same thing. Yeah. Miss Carrillo.
Fine, it'll probably be my last one. Sorry.
This is the exercise.
What about hormonal? It'll help with hormones because
Miss Carrillo, it does. I forgot.
stress.
Yeah.
Okay.
Oh, sorry. I was trying to. But she's absolutely right.
Actually,
By the way.
can you go into more detail?
Well, not much, by the way, but there have been studies to show that getting regular massage balances your hormones. Just the act of getting massage balances your hormones. So whatever your hormonal stuff is, it can kind of balance that out. Yeah, absolutely. Sure. Very good. Anybody else? One of my big selling points for massage, too, for people, too, that I like to finish up after we've gone through a lot of this stuff, is I just think extremely important that an hour a month or 2 hours a month, or really wish it was 3 hours a week, but is set aside for you and you alone. It is time for you and you alone. And massage is the only thing I know of where somebody is putting a lot of care and love and attention into you, and when you get up afterwards, you don't owe them anything besides the $100. Because even at home with people you love, like they take care of you. If you're lucky, they do, but then you're like, I gotta take care of them too. It's another thing on your list. This is something that's truly just about you. This is the beautiful thing about the exchange of money. You're exchanging money to get some guilt-free time just for you that you don't owe them anything else afterwards. I think that is super, super crucial. And one final thing, massage feels good. We eat dessert because it tastes good. You know, we do all sorts of stuff just because it feels good. And massage feels good. It has 0 calories, 0 guilt. It is actually, you are actually better off afterwards, and there are not a lot of things out there like that. You know, I love red wine, but it's not always necessarily a health drink, is it? Right? I love ice cream, but I wouldn't necessarily call that a health food. So massage feels good, and it is good. And I think that's all really big stuff, too. All right, everybody, this is a good place. We actually don't have a lot more to cover, and you'll have time to do your homework and finish it, by the way. Did anybody, by the way, come up with another benefit of massage while we were gone, the 15 minutes? Ms. Carrillo, please.
Yeah, I was thinking about it. So I said like the hormones. So if it makes the hormones better, in females, would that help their, periods?
Yeah, I
Like their
mean,
menstrual cycle a bit?
I would love to say yes, but I haven't read research that says yes. And by the way, don't just think of hormones with females, right? Guys have hormones too, and guys are hormonal. Like, part of this is a myth, this kind of concept that, oh, women, it's that time of the month kind of thing. Guys have a time of the day, by the way. They tend to cycle daily. And so, just thought I'd throw it out there. So, anyway, but yeah. But there have been studies that show that it helps balance hormone levels, so yeah, maybe. I could see it. Oh, I have had many clients tell me it helps with cramping. They're like, oh my gosh, they come in and they're like, I'm on my period, I need a massage. like they're like, it's killing my low back, and afterwards, like, oh my god, it feels so much better. So I've had lots of people tell me it helps with cramping. Yeah. And by the way, it also helps the people that know the person getting the massage. Right? Ever heard happy wife, happy life? Some guys say. But the fact is, like, when the person getting the massage has been taken care of, that person is now a better mother, a better father, a better friend, a better student, a better everything. Like, it really does have a ripple effect. You guys really will be changing lives out into the community. Miss Everson, please.
I think it has the potential to change pessimistic views and kind of restore faith in humanity with someone doing such a selfless job and doing a great job.
I love that.
Could
Yeah.
really restore faith in humanity.
Yeah. I agree with you completely. Yeah. It also, your bodies pick up on signals, and if your body gets the signal that it's okay to lay down and be rubbed, it gets the signal that we are not under attack. And so it kind of gets rid of that general anxiety and such too. But definitely faith in humanity. I love that. I love that. And to that end, by the way, everybody, it also teaches safe touch. And we don't teach that in our society. There's either no touch in our society or sexual touch. There is some in between, but we don't really teach anything in between. You are teaching people that, yes, I can hug you and love you and take care of you, and yet that stays there and it's appropriate and all that kind of stuff. It's a beautiful thing. Miss Avalos.
I don't know if anyone's had Miss Dimitrik yet, but part of how she starts her massage and the grounding process is she'll tell you that you're in a safe place. And when she touches you, it's kind of like a helicopter approach. It's just, she comes down real, and it's kind of, and then all of a sudden you immediately just kind of melt and relax. And when she says that, and her intentions mean that, it changes the entire massage. So I think that what she does is great. That's something we should all apply, because I really did feel, hey, I'm in a safe place, but my body responds to that.
I love that. I love that. You're right. What a wonderful thing to say. It's a wonderful thing to create too. But yeah, you're in a safe place, and then to have that intention. I love it. Miss Hendrickson.
Yeah, I was just thinking of like related to hormones, and also the sympathetic, parasympathetic system, where, you know, like if you're in fight or flight all the time, you're releasing like excess amounts of cortisol, and so reducing that has like a lot of health benefits. Plus, you know, when you have a lot of cortisol, you tend to carry extra weight around, so that could help with that as well.
Yeah, well said. No, you're right. I'm 100. You can't promote this. You can't say this, but I'm 100% convinced that you guys will cure cancers that they will never know about, because you get somebody in the parasympathetic state and their body, because you have cancerous cells in your body all the time. Your body keeps them under control. It's a normal thing. And you, by getting somebody the type of rest and into their parasympathetic state, you are healing things that they will never know about, and you will never know about. But yes, could not agree with more.
That's really cool.
It is really cool. I really can't see a downside to it. Miss Everson, You have your hand up. Did you have something else?
I did not, sorry.
Okay, excellent. All right. So lots of good stuff, everybody. And I love that you guys grasp the emotional aspect. It's why we do gratitude. It's everything. Because the person you bring to that client needs to be in the right space. Right? It's a absolutely beautiful thing you are choosing to do with your time to, to hold space for people of healing and love and that kind of thing and bring it to them. It's beautiful. Okay. There's not much more to go over. Let me kind of finish this, then we'll release some homework and all that good stuff. So we've talked about, we added about 45 things to this list here of things massage does. Potential risks are not a lot, by the way. Remember, as long as you're going slow, there are potential risks if you're going really fast, because you can torque something. But the potential risks tend to be bruising. Like, I don't think I've ever done anything more than bruise a client. I have bruised the heck out of a client before, who wasn't mad at all because she told me she wanted me to squeeze really hard, but I had my handprint on her arm the next time I saw her. And it actually fit my hand. It was disturbing. Anyway, but bruises go away. And if you're not digging in their axillary region, their popliteal region, armpit, knee pit, their inguinal region, groin pit, into their neck in the front, their anterior neck, their eyes, you're going to be okay. You really are. But you could cause nerve damage if you go in that deep. I actually don't know if I've ever even heard that happening in massage. I'm sure it's happened, by the way. I'm just saying it's that uncommon. So, and remember, when in doubt, just do a little bit and see how they feel next time. We've talked about scope of practice. Do be very clear with your clients about fees. Fees that you charge, don't change your fees with them. Be very clear. I hate to say, if somebody's like, hey, could you spend more time on my feet there, and that means you're going to be running over a significant amount of time, you need to tell them at that point, like, I'd be happy to do that, but I do have to charge you extra. Otherwise, they might just think you're doing it as a favor. Now, by the way, my personal rule of thumb is that on my private clients, when I go to their house, I run them all over at least 5 minutes. I do that so I don't look like I'm being petty and taking them down to the minute. But at some point, I need to charge them for my time. So just make sure you tell somebody that. Sometimes it's hard to tell them that because you're like loving on them and you're rubbing them, but you've got to really be like, oh, I'd be so happy to do that, but I need to charge you for the extra time. And you say time because it helps them realize, oh, that's right, it's your time. It's not just me asking for a little thing, it's your time. And you want them to ask for more, but we always tell them that's an upgrade, that's extra time, that kind of thing. Because you don't want them to be shocked at the end. And always make sure you discuss prices up front. They don't have to pay up front, but discuss prices up front. And I would say, by the way, too, from personal experience, if you ever get a major complaint, I would comp the massage. And that means give them their money back. And the reason I tell you that is because your reputation is worth more, and it will probably happen once in your lifetime. Like, it's so rare, but if somebody really hates my massage that much, I'm going to be like, you know what? Absolutely. I'm very sorry. I take a lot of pride in my work. You really thought it was that bad. No charge. Now, I'm not going to work on them again either, because I'm not doing that again. But no charge. And I wouldn't do that normally, but the fact is, it might happen to you once in your entire lifetime. It's very rare. So establishments deal with it more often. I'm sure Ms. Clayton deals with comping all the time, but she's got a whole team of people there. You personally, for your personal clients, if somebody was like, you bruised me and I think I shouldn't pay for that massage, that's when it usually happens. I'd be like, absolutely. You're absolutely right. No problem. I'm comping it. So it's easier for me to lose that one time than have any bad blood out there. Miss Everson, maybe? Hand up? Yes? No?
2-hour massage or a 3-hour massage.
You mean, would you comp? Well, I don't know. It would depend on how severe it was. You know what I mean?
Yeah. Like,
Yeah.
if you're going to someone's house and they, like, want a 2-hour massage and then they do nothing but complaint.
Yeah.
I get going over there, but do you comp a whole 2 hours, or do you just charge them for like an hour? Like, sorry.
Well, I'm gonna have some other people weigh in here. I've actually never had that happen, like that severe. I feel like if they were complaining that much, I might be like, hey, really nicely, like, I don't think this is working out for you. Let's just stop here. I won't charge you anything. I apologize. I'm sorry we are not connecting, and I'd let it go long before the 2 hours. But Miss Clayton, what do you say?
Well, we just we have a lot of complaints, and I don't mean we have a lot of complaints,
No, I know what you
but
mean.
we have a variety of complaints, right? So everywhere from the pressure was awful to I didn't like the way they, talked the whole time
Yeah.
to I think they shared inappropriate things. So we always try to make what we're doing equitable to, what the complaint is.
Oh, sure.
Obviously, if it's a major mistake, we'll comp the whole thing. Sometimes we'll say we're going to give you a free 30-minute upgrade on your next visit. Sometimes we give them a free peppermint scalp massage on their next visit. So it's not a one-size-fits-all. You have to think through it. And I think, being able to think on your feet will be really important. We don't get a ton of complaints. We get a variety of complaints. But I think a lot of it, again, going back to your intake, you're talking with them, you're asking questions throughout, trying to really get a good understanding of what they want, because that's when the complaints come in is that we didn't match them up with the right therapist, or the therapist didn't do enough communication to really find out what they were there for and what their needs were.
Yeah.
So,
I agree.
and a lot of times clients don't go ahead and just book a 2-hour massage. They kind of dip their toe in, so they'll get a massage, and then they'll kind of see that they like that particular therapist, and then that's when they'll lengthen the service.
Right.
Most of the clients do that.
Good point.
But you have to make these judgment calls. If they're complaining the whole time throughout, I think what Mr. Tapscott said is great. If they're not happy 15 minutes in, chances are they're not going to be happy 3 hours afterward either. So, it's always cost versus benefit. So if this is a good client, they've been coming to you and they happen to complain that once, it's different than if it's their first time in and they're just complaining about everything. So there's you just have to be good at critical thinking and looking at the cost versus the benefits. Am I going to lose more losing this client? Is this client going to go out and say all these negative things about me?
Yes.
Or, what's better for you and them long term? So.
I agree. And by the way, Ms. Clayton, you are making different decisions as a business owner, right, than an individual therapist makes with their private clients too. So usually, by the way, guys, as a private therapist, if you go to like somebody's house or they come to you, if they don't like your massage, usually what they do afterwards is they say, oh no, thank you, that was great. Yep, no, I'll rebook later, and you never hear from them again.
Mm-hmm. Yeah,
I'm talking about if they come back and complain to an individual therapist, usually there's something kind of big going on. At an establishment, you're absolutely right. I've heard it all. At the Princess, I heard people say, I want my massage comped because the air conditioner was rattling in the room, and that ruined the peace in the room.
Mm-hmm.
So
the other thing too that you guys are lucky about, and me too, is that the massage clients very seldomly complain directly to the therapist.
Yeah.
So I always tell my therapist, I'm like, you guys are lucky because they just say, yeah, thank you, and then they come up and unload on the front desk.
yes,
Or call. They
Yes.
most people don't like conflict, and it's hard to tell someone who just spent an hour rubbing you or an hour and a half or whatever, hey, you really didn't do a good job. So they tell us at the front desk, and most of the frustrations are taken out elsewhere.
That's
Very
true.
seldom will they unload on you or yell at you
Yes.
or tell you stink. They'll
That's
tell
true.
someone else before you. That's what I found.
Oh, I would 100% agree with that. I've had therapists be like, but they seem so happy because they don't like conflict resolution. By the way, that's a benefit and a liability, because when you are a private therapist, people again will not tell you they don't like your massage. They just don't rebook, and you
Exactly.
don't know why. That's why I make such a big deal about pressure. Because if they're like, oh, the pressure wasn't enough, and they didn't have the guts to speak up and say something, they won't ever say anything. They just don't rebook. That's it.
And the challenge for me as a business owner is when I go back to talk to these therapists, a lot of times they'll say, well, I asked them how it was and they said good. you know, they didn't say anything to me, and so I have to tell them, well, most people aren't going to tell you directly. They don't like that conflict. They don't know how to necessarily tell you.
Yep.
They don't feel comfortable. And so sometimes I feel like they don't believe me, and I'm like, look, I'm just the messenger. I wanted to give you this feedback so you can make adjustments, you know, if you want to. But, you know, I would say to all of you is please be open to feedback, good and bad, because it's how you get better. And, you know, I've encountered a lot of pushback from therapists in terms of them being open to learning new things and really respecting that particular client who complained. A lot of times it's like, well, all my other clients are happy, so that was, you know, they're just, and then they'll tell me, well, they just want free stuff or something like that. And I'm like, well, not necessarily. When you look at statistics, very few people complain just to get something for free.
Yeah, especially massage.
Exactly.
It's
so
too personal. I agree with you. I've had the same experience, by the way, when I was a manager. And so what I always do is approach them and say, okay, maybe this client's nuts, but when you get another client just like this one, what are we going to do to avoid this complaint again? Right? Because we have to figure out how to make a lot of people happy. You're absolutely right.
right.
And everybody, I would say this too, that's why we have to get our clients to speak up. So if you're like, do you want more or less pressure? Just the tone of your voice right there says, I do not want you to say more or less, right? I mean, you've got to create this environment where they feel they can speak up and tell you things. So you have to be like, oh yeah, absolutely, I get that. Yeah, I'm happy to work on that. I'm happy to do that thing. I'm happy. Because people don't want to speak up. They're naked. And they don't like conflict, and they don't want to ask you to work harder. Miss Everson, you have your hand raised.
Yes. So a different question, but what if it is like the end of the day and your client is 15 to 30 minutes late for their massage and they're still asking for the whole time, or they're asking to do the 30-minute massage, but they've booked like an hour?
Okay.
Do you only charge them for the 30 minutes, or do you charge them for the full hour because that massage therapist is then waiting on their time in order to get the massage?
So, Ms. Everson, by the way, if you work for an establishment, they tell you their policies, and you have to decide if you agree with those policies, and you have to live by them, right? But I will tell you, in general, they eat the time. In general, I have the client eat the time. Now, I say in general because my private clients, let's say you're my regular private client and you come to me, there's a lot of gray area here. You come to me for a 2-hour massage every week. You are actually bringing to my bottom line about $5,000 a year. Think about this, everybody. 10 people that come to you for a 2-hour massage once a week is $50,000 a year. That's an entire business right there for a private therapist. So if you're always on time and you're one of those clients and you're late this one time and I can make it up, I will. But you are somebody bringing 10% of my income to me. You are a great client. You're never late. I'm going to bend with you differently than other people. But in general, what I do is I will run people over 5 or 10 minutes to make up for a little bit of their time to show good faith on my part, but then I always have another client later I have to get to because I want them to recognize my time as valuable. So in general, you would show up, Miss Everson, let's say you're half an hour late. I'd say, Miss Everson, let's get in the room right away because we're running late. I don't know why I say we're, but it sounds nicer even though you're running late. And I say, I can make up about 10 minutes of your time, but then I've got another client. So I'm sure we'll get about 40 minutes in here. Let's go. And I've actually never really had anybody give me a hard time about that. They know they're late. I've addressed it, and that's it. But I charge them for it, yes. They're the ones that are late. Yep.
Yeah, I worked front desk at a massage place for a little while, and someone came in and was sitting in the parking lot and couldn't get off the phone call. And so they had their daughter call and ask if they could do the full hour, but it was closing time, and I told them unfortunately not. I said that they could do the 30 minutes, although they wouldn't be able to get the full hour, and they would be charged for the full hour because that was their time slot and they're taking the massage therapist's time.
Yeah.
And they flipped shit.
Oh, sure. I'm sure that happens, yeah. And by the way, you treat it differently at different places. You're absolutely right. At the Princess, by the way, if you're late, we give you your full time. But you're paying like $178 an hour for your massage. You're probably booking a $500 a night room, and you expect that kind of service, and we make it happen. But you're paying for that level of service too, right? It's a lot different. Miss.
Sorry.
Oh no, you're okay. Did you have more?
Yeah, are they independent contractors then? Because I know
No.
most massage therapists aren't getting paid unless they're touching someone's body. So if they're waiting around 45 minutes for a client, and then you give them the client that was late and it's only an hour, how do you,
Right.
is it the therapist to take that appointment, or can they take a different appointment that comes in?
Depends on how that place is managed. But by the way, most massage therapists are paid, not independent contractor, although there is a lot of that. They are paid on commission though, so you're right, it feels the same. If you don't do a massage, you don't get paid. And if you sit around for an hour, you don't get paid. So, but most establishments, Ms. Clayton, can you weigh in on what you guys do if somebody's late and how it affects the therapist? Ms. Avalos, I'll come back to you, by the way, I haven't forgotten about you.
Yeah, so just to touch on some of those things, when you work for an establishment, you're not an independent contractor.
Right.
When you're an independent contractor, generally what you're doing is renting out space, or you're in an establishment. And I know there are some, and I know that Lavender's Spa, you're an independent contractor there, but you need to be careful, because what happens a lot of times is they'll tell you you're an independent contractor, but then they set your rules, and that's really not, it shouldn't work like that. If you're independent, you're independent, you get to set your own rules and policies. So if you're going to a place and they're like, yeah, you're an independent contractor, but you have to follow our rules, I looked for some other place.
That's right.
But what we do is you get minimum wage or your commission, whichever is higher. And the reason we do that, and you never get minimum wage, because you're busy all the time. The only reason they have that caveat is when spas first open, sometimes you don't have sufficient clientele, so they can't be paying you your regular hourly rate when they're not making any money, or they go out of business. But after you have your clients, you're getting whatever commission. And the way we do it is we give a base commission, and then we give additional money for the additional services. So for example, at our spa, we do this differently. Not all spas do this, but I know that deep tissue is a little bit harder, more intense, and it takes more skill and knowledge. So we charge the client $10 more, and we give the therapist $5 of that. So they get $5 more just for the deep tissue per hour. Then if you add CBD, you get an additional $5. If you do a Himalayan salt stone, you get an additional $10. So, if you're adding deep tissue with the hot stone and CBD, you're making $20 more an hour. So, but each spa has a little bit of a different payment plan and method. But going back to the no-shows and the lates, that is something we struggle with daily, and it frustrates the heck out of me, because it's such a trade-off, right? So we used to just not take credit cards and just hope people came in. Now we take credit card numbers over the phone to reserve that appointment, and if they don't show up, we charge them $30. The corporate policy is you can charge them more than that, but it's a trade-off, right? Because you don't want to piss someone off and charge them so much that they're never coming back, but you also don't want them to just think, well, I don't have to go, because we do have a lot of clients that don't realize they're booking just you and your time, and they're very lax and kind of disrespectful in that they don't show up, and then when we do charge them or tell them they can't do that, they get really pissy with us, like you experienced, Ms. Severson. Our front desk gets that every day, all day. They get yelled at. And so my philosophy is we try to educate the client, right? So the first time it's okay, we're going to give you a free pass because everybody messes up. But the second time we charge, the third time we charge, now we're just charging a nominal fee, $30, so I can pay my therapist. Yep. I really don't make anything. So I'm the one that's taking the biggest loss. But then if they become habitual, we just make them pay for their service in advance, and if they don't show up, we take that whole thing. But again, it's really a trade-off. So I will fire a client if they're just a repeated, person. If they get too nasty, we just had this happen last week where the client was yelling and then started bringing other clients into it and just made a horrible scene. And we said, I didn't say it, my manager did. She said, unfortunately, we can't have you in here yelling at people, yelling at my front desk, yelling at my clients. We're going to cancel your membership, and I need you to leave now, or we're going to call the police. So we have all sorts of things, but people get really pissy about their massage and their time. But it's for us, it's very one way. It's all about them and never about us or the therapist. And it's one of my, probably the biggest challenge I have as an owner is that balance of keeping the therapist happy, not alienating the client, and trying to make some money in the interim. So I don't know if that answered your question, but it's a challenge. But again, I think when you're an independent contractor and you have that one-to-one relationship with the client, they're usually nicer and more understanding, again, because it goes back to that conflict. They have no problem having conflict with us, but they won't do that with the therapist.
That's true. They tend to treat the therapist better, you're right.
Yeah.
And by the way, when you're independently working too, there are all sorts of tricks you can do. If you have clients that you feel don't show up on time, I tend to put them at the end of my day. I tend to put them at times, or if I have clients that cancel a lot, I give them less premium times. I tend to manage them that way. You get them to prepay, all sorts of stuff, yeah. Miss Abelos.
I'm good. She hit on it.
Good.
I was thinking about Clayton's
Cool.
business.
Cool. Yeah. Hey, by the way, another trick I do, we don't do this at a spa, me personally would do this, is when you come out of your massage and you're paying for it, and I had a little Square app on my phone, and I could swipe your credit card, I'd say, hey, I'll give you $20 off your next massage if you book it now and pay for it now. And for some reason, when it's already paid for and booked, they were better about showing up on time and all that kind of stuff. It just helped a little bit. Miss Hendrickson.
Yeah, I was just wondering, if you're an independent contractor, are the clients still the spa's clients, or are they your clients?
They're yours. If you're truly an independent contractor, they are truly yours. Your booth rental. You're renting a place, essentially, and they are yours.
So you would still have, your own business card,
You could take that client list, you could do whatever. There's nobody that you have to worry about competing with, anything. You are...
Do you make your own appointments, or would the spa still do that for you?
It depends how your contract is set up. So some places you do booth rental from them, and you guys share a booking agent, right? And so sometimes they might book your stuff, but a lot of times you're booking your own stuff and you're just buying the space, really.
And what kind of services, what do you get out of that rental? Do they do the laundry for you or anything like that?
Yes, it just depends on where you rent.
Okay.
Yeah, some places do all the cleaning, the laundry, some place, it's kind of a sweet little deal sometimes.
Do you have to, is the rent expensive? How much are you giving up?
It's a few $100s, but it could be a few $100s a week. But I have students that do this, and what they do is they'll get a place and it'll have, a massage room in it or two, and they'll get another therapist to go in with them because they know they're not going to massage 7 days a week. And so one of them will take the place 3 or 4 days a week, the other will take the other 3 or 4 days a week, and they split the rent, and then it gets pretty cheap. And it works out pretty well for them, and somebody else is doing the laundry and there's security and cleaning and things like that. It works out well for them. So, but I can't answer your exact questions because it just depends on where you rent from.
Okay.
Yeah. Yeah. Mr. Richards.
I have a question. Do you know if we don't do internship and we do it at the school, is it a possibility to hand your business cards out at the school, or is that not allowed?
No, you can. Absolutely. So this is hilarious. We want you to steal our clients. You are more than welcome. We don't, because we're not making money off our clients anyway. They're pretty much paying for laundry. But we would love you to steal them. It would make me happy. It's kind of hard to do, by the way, because they're coming here to get a $10 or $20 massage, and you're going to have to upsell them, right? So a lot of our clients are coming here for the value. That's not to say they're cheap, but they're coming here for the value because they're like, I can get a whole lot of massages at $20 a pop. But that will happen, and you can pass out your card. and we encourage you to do it. And if you stole a client, nothing would make me happier. And sometimes, by the way, spa managers come by and get massages, and they're like, "Oh, I really like you, Mr. Richards. You should look me up when you graduate," and stuff like that. No, the clinic here is actually really nifty, and you learn a lot, and you can meet potential clients. Yes, that is a possibility, and please do pass out your cards.
Because you've got two sides of it. They're either coming because it's cheap, or they're coming because they know the therapist. So it's not necessarily just because it's cheap. It's because they know someone on the course, or they're getting a good deal.
Or what I used to do, like I would go to clinics like this when I was a spa manager, and I would go steal really good therapists. So I'd have to get about 10 or 20 massages. I'm not kidding, 10 or 20. And then out of those 10 or 20, one person would be amazing. I'd be like, "Oh my gosh, you're a natural. You need to come look me up when you graduate." And I would do it to farm therapists out and such. So the reason I say that is some clients are doing the same thing, Mr. Richards. They'd rather experiment to find a good therapist at $20 a pop than at $80 or $100 a pop to find a therapist they like. And once they find one, they often will. And that does happen, where they're like, "Do you do alcohol?" And you'd be like, "Yeah, I will once I graduate." "Cool, look me up." And you'll get them as a client. So that does happen.
And in the internship, obviously because you're working for them, but you've got no contract, are you allowed? Or is that a no-no?
Essentially no, but you're also not going to be working on their clients. On the externship, you are not working on massage clients. It's against the law. You don't have a license. You're going to be working on their stressed out front desk staff, the friends of their front desk staff, the massage therapists there, the friends and families of the massage therapists there for free. You won't be working on their clients that come in for massage.
Right, so it's more beneficial to do the school.
From the angle you were talking about, 100% yes, but there are benefits to doing the externship too, because you get a little insight into the company. Do I like working there and things like that? But yes, you could make really strong arguments, and I can't even answer it because I'm still trying to figure this out myself. I am not totally sold on our externship experience, but I'm not unsold on it either. I just don't know where I sit on this one. But yes, I do not think you are wasting your time by coming just to clinic here. You also still have a teacher here to kind of, ask questions and things like that and whatever. Yeah. Thank you. Those are all really interesting things. Ms. Hendrickson.
Yeah, I was interested, we were talking about, what was last week, we were talking about, like, the cancer care centers, how they do, like, the special oncology massage and stuff. Would it be possible to do an externship there?
Probably not. We can try. Cancer Centers of America is amazing, and they do hire massage therapists, and they're big believers in it. I'll reach out to them and see. But sometimes it's just the amount of training they want you to have before you're like, I don't know.
Mm-hmm.
But you might be able to go in there and shadow their people or something. It would be a phenomenal experience.
Or maybe just like do a job shadow.
Yeah. The other problem is sometimes the amount of background stuff that you have to have done to get into a facility like that.
Okay, yeah. That
You know what I mean? Because it's truly medical. And so, like, if you guys saw what you had to do to get in the nursing program here, it's ridiculous. And so, so I don't mean to poo-poo I love the idea. I just am concerned there'd be a lot of hurdles, but I will see if, I used to have a contact there a long time ago. I'll see if she's still there. She was in charge of the massage program, and a really neat lady. If she's still there, I'll ask her, at least, to find out. I like the idea. I mean, very cool experience.
I think it would be really interesting.
Oh, gosh, yes. Yeah.
Thanks.
Okay. All right. Sorry, write myself a note there. Okay, so anybody else, by the way, that I skipped, didn't listen to? Yeah. I think, by the way, Miss Clayton made the most important comments, which is it's frustrating and it depends. How important is your reputation? How much is this person worth? How many times should I bend with them? I love her policy, by the way, of everybody gets a freebie. Like, okay, we understand you're new, but let me explain what's going to happen the next time. It's challenging, though. There's no doubt about it. Okay. Let's see. Okay. Right to refusal. You and your client have the right to end the massage at any time for no reason. I was about to say for any reason, but I want to say for no reason. I don't think you should exercise this right all the time. I don't think because somebody winks at you, you should be like, oh my gosh, they're flirting with me, I gotta end this massage. I mean, try to be measured about it, but what I don't want to have happen is you're in a room with somebody who's being probably inappropriate and you're like, do I have enough excuse to end this massage? If you feel that you need to end the massage, don't sit there and think about justifying it, do it. And also conversely, sometimes clients will end massages and you'll inadvertently argue with them. They'll be like, I need to end the massage right now. And you'll be like, why? And are you sure? And you're just trying to be nice, but they're telling you they need to end it right now. It probably has nothing to do with you, by the way. They probably have to go to the bathroom, or they got a phone call, or they having an emotional episode, or who knows. But for whatever reason, just be like, okay, absolutely. Like, you told me you need to end the massage. Absolutely, okay. I'll see you outside. Like, I'm done. Do not argue with them, whatever. It probably has nothing to do with you again. But I just want you to remember, they can end it for any reason, and you can end it for any reason. Ms. Hendrickson, please.
If they end it, or I guess if we do, like, are you still gonna be charging them for the full massage?
I guess it would depend on the circumstances. Again, my personal experience has been usually when they end it, they do pay for the whole massage because usually it has nothing to do with me.
Okay.
Yeah, I have never had, to the best of my knowledge, had somebody end it because of me. They ended it because a bladder control problem, or an emotional meltdown, or a phone call they got, or they got triggered but they don't hold me responsible. And those people have all paid me. I didn't even have to bring it up. They just kind of assumed it. You know, as a private, your personal clients, this stuff works out much better than all the stuff that a chain has to deal with, that a storefront has to deal with. So in general, they pay. And I've charged clients where they've had kind of emotional breakdowns and stuff like that. And, you know, they're like, I'm like, do you want me to end the session? No. Do you want me to keep massaging? No. Do you want me to just sit here? Yeah. Sat there with them for a half an hour. I charge them for that. It's still my time. And people get that. People know that's how you get paid. They're pretty good. Yeah.
I think that's like, it's kind of, you have to like
Yes.
adopt that mindset. You're like, my time is money. My
Yeah.
time is money.
I just adopt that time set. And I also adopt the time like I really care. Like I really care. But like when I'm having an emotional day, I still have to pay my electric bill.
Right.
Right? I still have to make my house payment when I'm depressed. Like I understand you're having a really bad day too, but like that's how it works. People get that though. I've never even had to go that far. I do guys want to give you a rule of thumb that I use. You do not need to use this. It is different. I'm a guy. I'm sure it's different. I feel less intimidated in a treatment room than you would as a girl, right? And I realize there's guys out there too, but I realize it might depend on your size, your past experience, your sex, everything. But for me, my general rule of thumb is this with clients. I don't want to ever be wrong about assuming something's going on when it's not, and that would be terrible. And so I try to give everybody the benefit of a doubt. And so if they're doing something or saying something, with me, it can be anything. I actually prefer people that speak up instead of not, even if it's inappropriate, because I want it out on the table. I don't care what you say to me. I don't care if your hands are on the sheet or whatever. As long as once I address it and I say that's it, it stops. So I will let I'll be like, hey, sir, you really need to have your hands out from outside the table because I think that they're doing something inappropriate on the sheet. And they'll always tell you, just so you know, they will always tell you, I'm not doing anything. And I always answer, I'm not saying you're doing anything. I'm really not. It's just my policy. You need to have your hands outside the sheet here. Because I don't want to accuse them, and they may not be doing anything. That's what I do. As long as they do that, it's cool. If a client even said to me, and by the way, most of you should not go this far, but I don't even care what they say. Hey, would you do some extra favors in your massage? Absolutely not. Please don't mention that again. But I'll still continue the massage because everybody gets one thing. You get one warning. That's fine. I'm very cool with that. But guess what? They go, hey, are you sure? I don't even discuss it. If you set a boundary with somebody, do not discuss the boundary afterwards. Walk. If I told you that it's fine that you said that, but don't ever say it again, and you say anything, I don't even say you said it again, I leave. Go get the manager, go document, get out of the room, I leave. We're done. Because I'm super lenient about the fact that you just got to ask for things that are illegal in the massage room. But that's it. So when you set a boundary, you guys have to stick to your boundary. Because if they see that you're going to bend that boundary, they'll go further. So that's my general rule of thumb. Here's when they don't get a warning. When they touch you. And I don't mean they accidentally touched you, but if they touch you in some way that you feel is inappropriate, I don't even talk to them. I just walk out. That's just the end of the massage. So those are kind of my little rules of thumb that I use in my head. But that's as a 230-pound guy, right, in the treatment room. You might need to have stricter boundaries than that. And that's completely understandable. Anybody would understand that. That's just my kind of rule of thumb. I don't care what you said. I'm pretty understanding, but it stops now. That kind of thing. And I'm not accusing them either. Well, I didn't mean that by favors. That's totally cool, but we're not discussing it again. Right? Mr. Richards.
Yeah, that was kind of my question. Have you ever been in a room where someone's been appropriate or got on the table naked, and obviously people get aroused with massage, and have you ever been in that situation where you've had to, say, look, if you continue, it's done?
Yeah. Yes, I have. It's been a long time. Yes, I have. By the way, people getting aroused during massage and doing nothing about it is fine. That's really, in some ways, not under their control even. But I have had people proposition me, men and women, and I literally had to say no. And if you bring it up again, I end the massage. And 99% of the time, just because of the way I say it, and I'm not mean about it, I'm just like, absolutely not. And if you mention it again, I have to end the massage. 99% of the time, that's it. But I had a woman once I had to walk out on because that didn't end it. She thought she could kind of keep flirting around it, and I just walked out after that. Yeah.
And would you ever massage someone naked, or is that looking for trouble?
Were I naked or they're naked?
Them naked.
Okay. Because we're never
Because
naked. I just want to be very
like
clear.
Opening the door, isn't it? It's like...
Oh, wait. No, wait. What do you mean? They're naked under the sheet?
No, they're naked on no sheet.
Oh, no.
Say for,
No, absolutely not. Never. And by the way, I'm not freaked out by the human body. I wish we lived in a world where we could do that, but we don't. But also, you're breaking the law. Their genitalia has to be covered in a massage. It has to be. Has to be.
It sends the wrong message as well, doesn't it?
Yes, it sends the wrong message. And when I have people that go, oh, it's hot in here, I don't want the sheet, I say, well, the sheet is also for me. It's also for me. And that always works too for me. That puts an end to it right there. But yes, no, I would not. Don't let them push your boundaries like that. Yeah. At all. That's not a good sign. And it's against the law, by the way, guys. We need to cover genitalia and we can't touch it. Even if your intentions are the best in the world, we can't do that. Miss Carrillo.
I feel like the answer might be obvious, but I thought I'd ask it anyways.
No, please.
So you talked about how, you give your warning and then you walk out and things like that. I understand that in the spa setting, but what if you went to that person's house? That means you're leaving your table, you're leaving your blankets, you're leaving all your equipment at their house.
Yep. So
Right?
yes, you're absolutely right. A couple things. If you, especially you, Miss Carrillo, I meant as a woman, I'm not trying to be sexist, but I do think it's different. I would walk out of that house. I'd walk out of that house. I'd call them back later and say, you can set all my stuff outside, and my husband and I will come get it later. And I'd go, whatever. Depending on what they did, you may or may not file a complaint or whatever. I don't know. But I would walk right out of that house. The good news is, strangely enough, I don't know why this is, but people are, strangely enough, more appropriate at their own houses usually than they are in establishments. I mean, I think maybe it's because they live there and stuff like that. They tend to feel more anonymous at an establishment. You're just a person. But I've never had that problem. Also, I would recommend that essentially none of you go to somebody's house who's not a referral. So when I go to somebody's house, and again, I think it's different if you're a 100-pound person as opposed to a 230-pound person, but all my house calls are because somebody else referred them. And if Johnny's my great client and this is Johnny's cousin, you tend to be in a relatively safe situation. But again, yes, leave. Get out, get out, get out, get out. Don't ever be in a room thinking like, should I get out? Get out, walk outside.
Can I extend my question? Because maybe not everyone can get a proper referral. Maybe they just happen to get just someone. You ask to get the equipment, or ask for them to just lay the equipment outside. But what if you show up and they don't put the equipment outside? Because there are some people who would be spiteful enough, I think, to do that.
Well, I mean, we could play what ifs all day long, right?
Yeah.
Right? There's all sorts of what ifs. I have never once heard that happening. Most people know when they've been inappropriate, and they sure don't want to take it further, right? And even though it's your word against theirs, you know, they probably want just an end to this thing. And once you've left and no longer can kind of be victimized in that situation, I suspect they're going to put your stuff outside. I don't think you're going to have a problem with that. I just don't think you're going to. But just to let you know, you can contact the police. And even if they don't believe you what happened, you can say, I have items that are inside this house. I have proof this person booked with me. They're going to knock on the door and the person's going to be like, oh, like, trust me. The last thing I want somebody to do is accuse me that I did something inappropriate sexually. Oh my God. You're going to get your table back. Don't you worry. Yes. And I don't think it'll ever happen, which is the good news. Ms. Hendrickson? Miss Hendrickson? Miss Hendrickson? You're sorry? Can you unmute? It can't be done. Wow. Okay. Well, we enjoyed talking to you. For the rest of the program, we will not hear from Miss Hendrickson anymore. All right. Well, it's been lovely. We'll come back to you, ma'am. Miss Clayton, did you have your hand raised for a second?
Yeah, I don't, like, you were worried, Miss Priya. I think they will definitely put the stuff out there, and all you have to do if they don't is threaten to call the police, because they know they've done wrong, and it's theft of your items. So I have threatened to call the police on a few clients, just because they were acting so inappropriately. And one client actually came back in 10 minutes later, because she refused to pay for the service. We had tons of issues with her previously, and I had never encountered it because I was never there when she did this, but she did it with me. And she's like, well, she was very entitled, and, would tell us how much money she had every time she came in. And she said, well, I'm just not paying for my service today because I didn't like the way they did something. It was really silly. And I said, okay, well then I'm just calling the police. And she walked out, and I wasn't going to call the police. I just said it because she's stealing services. And evidently it upset her because she sat in her car, and then she came back in, and she put her hand in my face, and she was trembling, and she's like, look what you did to me. It was my fault.
Yeah.
You made me so upset that you said you were going to call the police. I'm just going to pay, and I'm never going to come back. And I said, well, you're stealing services. You can't just walk out of places and not pay. It's just not how we do things in America. And so she paid and never came back, but I was fine with that because she had caused many problems. But most people will get pretty scared if you threaten to call the police. That's all I wanted to say.
No, it's really good. And by the way, as a spa manager, I've had to have very difficult conversations with very wealthy people who kind of pulled the same stuff. And they say, well, that didn't happen. Like, I didn't proposition that therapist. And I say, you know what, sir? It's usually a sir, I hate to say. You know what, sir? You could be absolutely right, but you know how messy this is going to get if we have to pursue it further. And usually, like, you're right, I'm paying for my service, you'll never see me again. Because whether they did it or not, they know. Who wants to have that dragged through the court system, right? It just doesn't ever look good. So, yeah. this all works out pretty good. And by the way, again, most of the time your clients are referrals. They all love you. They've referred somebody else that's going to love you, and you don't have these problems. So, anybody else? Let's see. Ms. Hendrickson, are you still working on? We now can't see you.
I got it. I switched back to my
Oh.
laptop. My tablet was getting frozen. I think it was because it was about to die, so I couldn't unmute or unraise my hand or anything. I was just gonna ask if, so if someone is, like, inappropriate and you have to leave, like, the massage, would you, like, just automatically, like, kick them out of the place, like, never book with them again as well? Or would that just be, like, I mean, I would think you'd probably not want to give them another chance to do that again. Are you asking me? Oh, yeah. What
Yeah.
would you do?
Go.
What
Yeah, go ahead.
sorry.
No, go ahead.
What we do is I will call the person. This happened like a month and a half ago. With it was a male client, female therapist, and she kept, and I had told her, I'm like, you need to end services, and again, not everybody listens to me. So she did the entire service. He had said some things, did some things, and she kept second guessing herself. And when he finally came out, he made a comment to her, and it was at that point she knew that he was inappropriate. And so I called him up, and he scheduled like 8 massages with her.
Yeah.
So I find out, they call me and tell me this happens. And so I said, okay, I'll get back to you. I called the client. I said, Mr. So-and-so, you had a service in our establishment today. And I just wanted to let you know that our female therapist did feel a little uncomfortable with some of the things that were done and said in that service. So, going forward, if you'd like to come back and visit our location, we will only book you with male therapists.
Yes.
And he didn't push back or say, I don't know what she's talking about. He goes, okay, yeah, just cancel all my future appointments. Thanks.
Yeah.
And he hung up. And he didn't even try to defend himself, so I knew 100%.
He knew he was doing
I
it.
knew it, and that was it. So.
Thank you.
Yeah. And I always deal with this stuff by the way, I've released all your homework, everybody. So there's 2 homework assignments in case we're running this conversation on the ground for you. But yes, I found that I don't even have to accuse clients. I just say, hey, these people felt uncomfortable. I had this happen in a clinic once. I had 3 different students. Guy didn't even do anything. All 3 students said, didn't do a single thing. He just creeps me out. But after the 3rd student told me that, I thought, I just don't feel comfortable. We're at a school. And I just called the guy up and said, we've had a number of complaints that people feel uncomfortable around you. He said, I didn't mean anything by it. I said, I'm not accusing you. I'm really not. But I have to take care of my students first. And I just can't have you come back here. And you can't argue with that. And I really meant it. I still to this day don't know. But I'm just like, it's just not working out. And we're allowed to say no. It's okay. And that was a minor thing in the sense that he never said anything or did it just. But after I got 3 complaints on that, I'm like, my duty at that point. Yeah. By the way, if you guys do have to leave a treatment room, go tell your manager right away. Tell your manager right away. Or call your spouse right away, or call a friend right away. And if you can, write down everything that happened in the treatment room in an email and send it to yourself or somebody because it timestamps that information. That's kind of a good way to document. Mr. Richards.
Yeah, so people that offer, I've heard it since I got to America, but they call it happy endings. So
Yes.
people that offer happy endings, so to speak,